the office, I often have athletes ask me about target heart rate. Can you tell us more about what that means, an individual target heart rate, and how?
Well, and at least in our adult world, we go to a physician and we, for example, get a stress test. They target a certain rate, and that depends upon age. So, for example, the rule of thumb is you take a baseline of 220 beats per minute. You subtract your age. So if someone, let's say, were 40, 220 minus 40 is 180, and then generally that's the maximum you'd want someone to reach. But you multiply that by about 80%, and that would be the ideal heart rate that you would get. So it would be 80% of, let's say, 180, which might be around 160, would be your target. So, for example, when athletes are training, depending on their age, you shoot for that target heart rate, which is, as I said, really based upon, age. I mean, older people are not going to have as high a target as younger people.
Okay, and before you had said, when you were talking about aerobic exercise, you said as people do that type of physical activity, their heart rate tends to drop. And there are some terms that have been related to that happening. It's called athlete's heart, or what some people call athletic heart syndrome, or bradycardia.
Right. Well, bradycardia means slow heart rate. And it's amazing how many times I'll see a teenager in the office referred by a physician because they listen to the youngster, and the heart rate is, let's say, 50. And then they walk in and they take off their shirt, and the first thing I say to them is, I think we should switch places. I need to be on the table, and you need to be examining me. Because bradycardia is what you see, a slower normal heart rate. The term athlete's heart is really when you look at somebody's heart, let's say on an electrocardiogram or an echocardiogram, and the heart thickness is a little bit more than you would expect for someone of that size or age. In other words, it's somewhat hypertrophied. So we tend to use the term athlete's heart for a heart that's a little thicker, and also for, like a marathon runner where the heart may not only be a little thicker, it may be a little bit bigger, and in addition, their hearts are slower. So the bradycardia refers strictly to the heart rate, while the term athlete's heart encompasses the slow heart rate, the thickness of the heart muscle, and maybe the slight dilatation of the heart as well. It's a good thing. In other words, to say someone's got an athlete's heart, not a bad thing.